Greetings from Statue of Unity, tallest statue of world, and we all are proud of that statue. And before I go to the subject,
शुभं करोतु कल्याणं आरोग्यं सुखसम्पदम्.
respected seniors and dear colleagues, serving Foxy for years together, on this auspicious day, with folded hands and down head, I seek your guidance, blessings, and support to endorse my candidature for the post of Foxy President, year 2026, election year 2024. Consistently working for Foxy and trying to visit even a smaller societies and to assist our common Foxian friends in any given situation, I have tried to serve Foxy. I assure to serve Foxy in the same way with the same zeal and enthusiasm. पथ का अंतिम लक्ष्य नहीं, सिंहासन चढ़ते जाना, लिए सभी को साथ, आगे है बढ़ते जाना. So please endorse my candidature for post of President Foxy. Election would be from 1st August to 10 August. So consider my seniority, sincerity, dedication and easily availability to any Foxyian friends in any odd medico-legal crisis. And let us come to the topic, medico-legal issues in obstetric mishap or emergencies and why medico-legal important in current scenario. So thank you, Society and Dr. Sarda Jain Madam in particular for inviting me to share my views about the subject. Usually I start any of my talk with this question. Is it worth discussing? Yes. And if it is yes, then why? Rightly mentioned previously also, medical litigations are increasing in number constantly and steadily, and unluckily, we gynecologists rank first. And this is statistic from courts only. This is not our statistic. In total cases faced by any doctors, 29% share is from gynecologists, followed by orthopedic surgeon 22% and then others. So we are in driving seat as far as these medico-legal consequences are concerned. So warm welcome all the delegates and wishing you a litigation-free practice. We are working in this era. ऑपरेशन सफल रहा, अब डॉक्टर को कोई खतरा नहीं. Previously it was not there, but previously this was the situation. Before surgery, before any procedure, before admission, doctor was telling to the patient, don't worry, nothing will happen to you. But now scenario is changed. Now patient is telling to doctor, don't worry, nothing will happen to you. So it is totally changed. And our situation is like this. We have to save mother, we have to save baby, and at the same time we have to save our own cap, and that is our obstetric practice. And in our obstetric practice, we take utmost care of any of our patient, but accident may happen at any time, and we never know when accident happens. And many a time we are happily enjoying train journey. From our own window, we see our own train going into hell. And this is real picture taken by Navy exercise of British Army near sea coast of South Africa. And this accident was happened. So our situation is like this. We are just like this innocent bird, always at danger of cobra. And accident may happen in our practice like this at any time. Like this at any time. Accident may happen. Like this. And due to all this medico-legal consequences, defensive medicine has started. And it was studied that 83% physicians practice defensive medicine. Many a time unnecessary test, procedure, we have to consider. Many a times by clinical examination, we are sure of our diagnosis. Even then, not to end up into any kind of problem, to support our diagnosis, we subject patient to certain investigation. And as far as our obstetric emergencies are concerned, it is just like 9-11, and many times it is very late when we diagnose the thing, and one cannot be smarter like this every time. So we should be very careful, and few of our friends in their mind like this, it will never happen to my patient, but we never know when accident may occur, and they enjoy their practice just like this. So, in many times, etiology is very hard to find out and difficult to diagnose in some of the cases, and it is very obvious. After the CP is sunk, everybody knows how it could have been saved. So this is our obstetric practice, and as far as some laws are concerned, we have to see all this labor law, criminal cases, MTP Act, Atrocity Act, Biomedical Waste Disposal Act, Clinical Establishment Act, PCPNDT Act, CPA, Professional Tax, Income Tax Act, Birth and Death Registration Act, ART and Surrogacy Act, POCSO Act, and all over this National Medical Commission is also there. And this is a list of almost 153 different laws pertaining to medical practice. So our position is like this. We are studied with so many laws, and still we have to work in this situation. And every challenging case is potential threat as far as medico-legal consequences are concerned. And treating serious patient could be suicide as far as medico-legal consequences are concerned. And scenario may change in practice like this at any time. Like this at any time. Scenario may change. And we are bombarded with so many questions when something goes wrong. Why this happened? Who is responsible for that? Where were you? Why you couldn't prevent it? So we are facing this type of questions when we are facing any litigation. Let us see few of the cases which are real happen cases and decided in different courts. It was unbooked patient investigated and treated by another gynecologist. This is a case in that very state. There is a customary tradition that first delivery should be at maternal place. So previously she was investigated and treated by gynecologist at her in-laws place, but now she had been to her maternal place, and one fine morning at 7 a.m. she had been to this gynecologist very first time with labor pain. It was breach at perineum. She was delivered by assisted breech delivery, but after normal delivery of placenta and membrane, she developed convulsions and sudden cardiac arrest. She was resuscitated well. Opinion and help from physician and anesthesiologist were taken. Patient was shifted to tertiary care center for further care, and she expired after 4 days during course of treatment. Case was filed, notice was served. Allegation was we had been to normal consultation only, which was very wrong allegation, because they had been to hospital at 7 a.m. and it was not routine consulting hour, and she had labor pain. It was breach at perineum, so it was not for normal consultation. But more allegation. Doctor gave heavy injection in glucose bottle, so she delivered and developed convulsions and cardiac arrest. So these two were the allegation. But what happened in this case? Doctor handed over all the papers of treatment given to his advocate, and he didn't bother to remain present in the court even once. So in the court, court has an inference that doctor has not bothered to remain present in the court even once, and for any reason, paper submitted to advocate, he didn't produce those record in court of law. So one more inference made by the court was doctor has not produced any document about treatment given. So in this case, compensation of 3 lakhs with cost with interest was awarded in favor of patient party. So with this carry home message is never rely upon your advocate totally. Be in your constant touch of your advocate and give him inputs about your case, favor and against. Let us see one more interesting case. Again it was unbooked patient, primary, 34 weeks, PIH. Again it was the same situation. She had been to her in-laws place previously. She was being treated by another gynecologist. But with this gynecologist, it was very first visit, and at that time she was 34 weeks pregnant and it was case of PIH. So gynecologist advised all necessary investigation and treatment, but unlucky on part of patient and that gynecologist too. Very next day, she developed abruptio and intrauterine fetal death. Cesarean section was advised, but relative opted option to take patient to another town for second opinion, and they went to surgeon in nearby town. Cesarean section was done, but again unlucky patient and unlucky surgeon too. She developed atonic PPH and hysterectomy was done. Imagine the situation: primary patient, intrauterine fetal death and hysterectomy. Case was filed, notice was served. Allegation to first gynecologist was not properly managed to prevent abruptio, and to surgeon was not tried to prevent PPH, and atonic PPH was not managed properly. Luckily, I was defending both of them in CPA court. So, first I could convince court that what is abruptio, what is PIH, and what one should do when one comes to know that it is a case of PIH, and whatever investigation or treatment one supposed to advise to the patient was given by this gynecologist, and we could prove it by standard textbook. So gynecologist was out of this problem. As far as surgeon's part is concerned, as far as atonic PPH concerned, again we could convince court that what is atonic PPH. It may occur at any time, irrespective of mode of delivery, but how one should react, one should do as far as atonic PPH is concerned. And in this case, surgeon went with oxytocin, ergometrin, prostadine, then 3 units of blood was also given, stepwise devascularization, compressive suture. So he left no stone unturned to control PPH, but ultimately bleeding was not getting controlled. So ultimately, to save life of patient, hysterectomy was done. So at the time of argument, my last sentence was this: we have not removed uterus, we have sacrificed uterus to save life of patient. And luckily, in this case, decision was in favor of doctor. So with proper documentation and with proper presentation in court, we can win the case. And it is very difficult to prove negligence against doctor if we put our case well in our favor. Let us see one more interesting case. Again it was primary patient. She was known case of mitral stenosis, and she was advised not to have pregnancy till proper treatment of mitral stenosis. But as usual, patient had a poliomyelitis also, and she was investigated at town place of Gujarat, and as she was advised, but she didn't take it seriously. She was pregnant, and till 20 weeks of pregnancy, she didn't taken treatment from anybody, and she appeared for very first visit to this gynecologist. Again gynecologist advised, because it was non-compensated cardiac activity, balloon mitral valvotomy. But again patient was not serious about treatment. She absconded from the hospital and reappeared for very second visit at 34 weeks of pregnancy. So from 20 weeks to 34 weeks, she didn't take treatment from anywhere. So cesarean section was advised with balloon mitral valvotomy. Cesarean was done, but unlucky on part of patient and that gynecology, she developed stitch sepsis, went into septic shock. She was transferred to ICU for further care, but expired during course of treatment. Notice was served, and allegation was no proper care taken to avoid sepsis, leading to septic shock and death. There was total non-compliance on part of patient, but this was not taken at the time of discussion. Of course, we could convince court. In this case also I was appearing, and we could convince that patient was totally careless. Whichever treatment or advice we gave to the patient, patient has not taken. As far as this allegation, sepsis part, so we could prove in court of law by our autoclave register that whichever instrument were used in this very cesarean section and drum which was prepared was up to a standard guideline, and we could prove from the court. And as far as treatment part is concerned, before cesarean, during cesarean and after cesarean, not to end up into any kind of sepsis, and we won this case also. So how we represent our case in court is very much important. Let us see, this is also very interesting case and real happened case in city of Ahmedabad only. It was RH negative patient, it was book patient, regular antenatal checkup, and doctor advised to go for elective cesarean section for some indication and with all arrangement of blood because she was RH negative. But she refused to give consent and she absconded from the hospital. After 3-4 days, she had been to hospital in middle of the night with an emergency. It was acute emergency and straightway to go for cesarean section. Doctor has no time to arrange for blood. Of course, she tried to have a sample and to send nearby blood bank, but before they could arrange blood, cesarean section was very much necessary. So she started with cesarean section. But again, unlucky on part of patient and her too, there was bilateral uterine artery tear. And patient was RH negative, blood was not ready, cross match was not ready. So during shifting patient to nearby Municipal Medical College Hospital, patient expired on the way, case was served, notice was served, case was filed, and allegation was not anticipated complication, procedure or intensive care. So in this case, post-mortem was done, and in post-mortem examination, this was the inference: intra-abdominal hemorrhage following negligent surgical procedure. As such, person who is doing post-mortem examination, he has to simply mention what is the cause of death and what is time since death. He cannot comment like this negligent surgical procedure. So this type of report can be challenged in court of law. We have challenged so many post-mortem examination report in court, and many a time court is convinced that it is not relevance with our clinical finding or clinical examination. So in this case, this was the finding. One more area was no blood kept ready. So it was inference held by the court. As such, she had no time to manage. She sent sample, but before blood becomes ready at blood bank, she had to rush for cesarean section. One more inference held by the court was medical record not to be believed. Because in note of gynecologist, in operative note, she wrote vitals were within normal limit. And at the same time in note of anesthesiologist wrote that vitals were compromised. So at the same time, note of gynecologist and note of anesthesiologist were in contradiction. So records were not taken into consideration, and compensation of rupees 2.35 lakhs was awarded in favor of relative. This case was decided in 1997, and at that time this amount was also big amount. So in this case, observation as far as our medico-legal practice is concerned, 80% medico-legal cases against gynecologists are related to obstetric, and rightly mentioned by madam also, 80% of those cases are related to cesarean section complication, and out of those 80% cases are related to hemorrhage. So it is very obvious, if one wants to be 80% free of litigation, then one has to take care of hemorrhage. So common reason for litigation is not cross-matching blood during high-risk pregnancy cases. So carry home message with this case, cross-matching especially when you are dealing with a RH negative patient, because you never know when blood may be required. Just 10 days only I had a cesarean section of RH negative, and when I was in full-fledged OB practice, I had routine to send blood sample in each and every patient, irrespective of mode of delivery, normal, instrumental or vaginal, on admission only. And if it is not required, we were not demanding, but blood 2 units at least ready in nearby blood bank, it was my practice also. And as far as consent for blood transfusion is concerned, so in one of the cases, it was observation and guideline from court that surgery involves risk and blood transfusion involves additional risk. So separate consent for blood transfusion is very much required. And proper record keeping is always at your rescue. And we should be very careful. There should not be contradiction in note. If we have involved other professional colleague to manage patient, then there should not be any contradiction. Because, and one more thing, in our record and at the same time in nursing chart also, many times what happens, in our finding, if you have written pulse 120 and in nursing chart if it is written 180, then it becomes very difficult to face in court of law. So whenever you submit any record to anybody, please see that there should not be any contradiction in our record. And just I mentioned about this also, many of our friends have habit to send blood sample at the time of admission only. So with all these cases, what happens when we are happily enjoying this type of parachute sailing? We never know this much crocodiles are ready to receive us at bank. So exploitation starts. When something goes wrong, exploitation starts. Vastraharan starts. By whom? By patient, by relative, by politicians, by police, by pleader, by press, by so-called social workers, by protection group. And what could be the reaction on part of doctor? Litigation, oh my God. And one is confused. And naturally, when you are facing this type of signal at crossroad, you will be confused. One may try to hide the thing, one may be panic, one may try to ignore the situation, or one may try to influence the situation through friend, through relative, by money, by muscle power, or through politician. And many a time, legal phobia develops. But is this end of road? Then what to do and how to prevent? Only three things we have to observe, and court and law also expect from us. Practice foreseeability, that is anticipation, good communication and proper consent, and proper documentation, and you will be simply sail through. As far as foreseeability or anticipation is concerned, court expect from us to anticipate certain complication and procedure and intensive care, and we should be readily available to deal with the situation. Say for example, if it is a case of central placenta previa, naturally one should anticipate she may end up into PPH, she may require blood transfusion, she may require obstetric hysterectomy also. And if we are prepared to deal with situation, we are out of problem. But in all this situation, proper counseling is very much must. And it is very obvious and common dictum. It is always better to spend time with patient rather than to spend time with patient or relative in court. So proper counseling is very much required. And at the time of counseling, usually we start like this. What is the complaint? And there are so many questions on part of patient. Why did it happen? How it can be avoided? Will it happen again? Could it have been avoided? So as far as our counseling is concerned, and it was decided in case of Samira Kohli versus Prabha Manchanda, and court has given that at the time of counseling, what you have to explain to the patient about probable morbidity. When you are dealing with a very high risk pregnancy cases, then possibility of mortality also, all probable complication you have to discuss, probable prognosis, and all the alternative modalities of treatment we have to offer to the patient. Patient and patient party may select any one of them, but we can say which is the best available alternative to the patient. Probable expense also we have to explain. Risk involved in that very condition and treatment we have to explain. Possibility of blood transfusion if it is required we have to explain. And as far as outcome of baby and possibility of need of NICU care should also be explained. But whatever we explain, it should be in a very simple language, no much medical jargon. And as far as result is concerned, no rosy picture about result, no tall claim about result. Because in eye of law, when you claim to be master, you are supposed to be master. Because law is very clear in that way. And in our obstetric practice, we consider result like Aishwarya Rai, but it may turn like this at any time. So no tall claim, no rosy picture about picture. And so proper communication and documentation of that very communication is very important. Because in this famous case, C. Jaipal Reddy versus Padmini Veluri, National Commission has very specifically mentioned that consent is not mere piece of paper where patient or patient party has to sign, but it is a very important document of your communication, of your counseling. Whatever you counsel, whatever you communicate, it should be mentioned in consent paper. So when you mention everything in consent paper, it becomes documentation of your communication. So whatever you have communicated is documented in consent. And once you offer all those documents in court of law, it becomes communication of your documentation. So communication, documentation, documentation of communication, and communication of documentation. But in all these cases, records are always at your rescue. So keep them up to date. What was done, nothing was neglected, given treatment fully met with standard demanded by law and ethics, and it should be easily acceptable whenever offered in the court, and it is very obvious. Doctor is bound to produce record when asked by the court, and if he doesn't, then adverse inference might be drawn. And it is very obvious, good record, good defense, poor record, poor defense, and no record, no defense. And it is experienced during my medical legal practice. We doctors' friends are very poor as far as record keeping is concerned. And many a time it becomes very difficult for us also to defend doctor due to poor record keeping. So we should be very careful. Important bills, this is also part of our record. Say for example, purchase of oxygen cylinder, ventilator, defibrillator, ambu bag, emergency drug. And not only purchase of oxygen cylinder, but bill of refilling of oxygen cylinder is also part of your record, because in this case, it was decided in National Commission, and real happened case of city of Vadodara, only Gujarat. Patient party had an allegation when he suffered heart attack, oxygen cylinder in hospital were empty. And we were saved in this case only due to bill of refilling of oxygen cylinder just 1 day prior. So we could prove in court of law that oxygen cylinder were not empty when he suffered heart attack. So mere bill of refilling of oxygen cylinder, how it can be useful, we could prove in this case. One more area, non-compliance. Many a time patient doesn't follow our instruction. And when patient doesn't follow our instruction, and if we can prove it, then it becomes a contributory negligence on part of patient, and it becomes good defense in our favor. And many a time in our practice you will be observing that somebody is accompanying the patient, say for example mother-in-law. She will complain, doctor, she is not taking medicine properly, she is not taking proper diet, she is not taking milk. So make a habit to enter into record. She is not taking medicine properly, history given by mother-in-law. This simple sentence becomes good defense in your favor if at all you have to face litigation. Say for example, if you have advised for a checkup, and if she doesn't turn up, document it. Advise blood sugar and not done, document it. Advise insulin in case of GDM and not properly taking, document it. If you have advised to maintain fetal movement count and not maintaining, then document it. So whatever you document will be in your favor. And very important part is, do not alter record, because it leads to a loss of credibility in court. If at all you want to change, of course you can change, you can stick it out, but it should be readable what was written previously, and then you can add. So whitener, etc. we have not to use. And this is also very important. You can have record on paper, on dictaphone, on computer, or any other media. And as far as preservation of record is concerned, if we go by law, then as far as PCPNDT related papers per record to the National Registry, and in case of surrogacy, 25 years. And in case, if you are closing practice of ART or closing hospital before 10 years, then records are to be transferred to National Registry at that point of time. If at all you are facing any litigation, then till final disposal of that very case, you have to preserve all the record. If we go by guideline, guideline on part of NMC, OPD case paper for 2 years, indoor case paper for 3 years, and as per guideline from FOXI, indoor case paper for 5 years. As far as income tax related documents are concerned, then 7 to 10 years till final filing of our income tax return. But very important part is pediatric patient, that is our delivery patient. 18 plus 3 years, we have to preserve all the record. Because after attaining majority, that baby may sue within 2 to 3 years for any allegation. So you should have record, it is required. And whenever you give any copy of the record, original should always be with you and you have to give computer copy only. If in case of any litigation or for any reason, if original case papers are demanded, then of course you can say, for example, if patient demands, I want original case paper only. You can give, but you will take in writing from patient that I want original case paper, and in copy of that very case paper, she will write that I have got or I have received all the original case paper. So it is very important part. One more area, discharge card. It is also very good document of our treatment given. So we enter all the important things in discharge card, but proper instruction are very much important about diet and medicine to be taken, exercise, follow-up, and particularly references. If at all you have advised any reference to anybody, it should also be mentioned in discharge card. Because in this case, which is decided in state of Tamil Nadu, it was case of premature delivery. Baby was admitted in NICU, and at the time of admission, during course of admission, and at the time of discharge, the baby was discharged within 2 to 3 days, she was fine. But nobody advised parents to go for opinion from ophthalmologist to rule out retinopathy due to prematurity. And in due course, baby went blind, case was filed, and case was decided in favor of patient, and 1.8 crore was compensation awarded to the patient. But it happened in government hospital of Tamil Nadu. So out of that amount, 1.73 crore was to be paid by government of Tamil Nadu and rest of the amount by neonatologists. In this case, luckily, gynecologists were not made party. So we should be very careful. If at all any references is concerned, we have to mention at the time of discharge only. Take tender care of your patient. And very important part is visit your indoor patient regularly and make a habit to enter into indoor record. Of course, we visit our indoor patient very regularly, but we have not habit to enter into record. So we have to enter into record date, time, seen by, whichever our finding, whichever investigation or treatment we have. It shows our concern that we are taking utmost care of that very patient. Proper post-operative care, and particularly when you have operated at another nursing home, because you are under obligation to take post-operative care. Either you have to take or you have to manage care to be taken by equally competent person. So this is very important part. One more area, telephonic instruction, always to be avoided. Because in recent past, in one of the cases, it happened, instructions were given on telephone and patient went with some side effects of that very drug. Case was filed and case was decided in favor of patient, and compensation of rupees 5 lakhs was awarded in favor of patient. Recently, this judgment came. So we should be very careful as far as telephonic instruction are concerned. One more area, making statements that might be construed as an admission of fault on your part should always be avoided. Never commit that it was mistake on my part. Whatever we did, it was misfortune on part of patient and ourselves. Otherwise, we have taken utmost care of that very patient in that very given situation, what any other gynecologist would have taken. Casual discussion of treatment given to anyone always to be avoided. If at all specifically asked by patient or near relative, then only we have to discuss. Otherwise, not to be discussed with anybody else. This is also one more very important area. Give follow-up treatment to the patient who has served you a notice if required. Because you cannot abandon patient in between, and if you attend that very patient, even if she has served you a notice, if as usual, this is not exceeded, then case may be filed. But on other hand, if answered properly, if managed properly, then it may prevent further litigation also. One more area, be ready to be helpful to any of your professional colleagues in given time, because it is a need of time to be helpful to each other. And at the same time, please do not hesitate to take help from your professional colleague, because balanced teamwork is always beneficial not only to the patient but to the doctors also. Select proper staff, supervise and lead them properly. It is also very much required. कठोर परिश्रम का कोई विकल्प नहीं. Never ever give up. Keep trying and ultimately you will be succeeded. Use your optimum skill. Examine female patient in presence of female nurse or relative. This is particularly for male doctor. And as far as consent is concerned, always obtain informed consent before any procedure or surgery. This is also a very important part. Check your equipments, instrument, medicine at regular interval and keep your emergency kit readily available in any given situation. Do not ignore any complication due to size, because even a minor complication may be troublesome in future. Do not get hit wicked. Know your limits. Do not take risks. Remain alert every time. Otherwise, be ready to face this type of situation in obstetric practice. Observe confidentiality. Patient must not be abandoned in between. If at all you have to transfer patient to higher center, then it should be in time, it should be at proper place with escort, and all the transfer document you have to submit to the patient and patient party at the time of transferring the patient. Say for example, name of patient, date and time of referral, reason for referral, details of condition of patient, vitals when first seen, vitals when referred, history of comorbidity, operative detail, and copy of indoor case paper. All investigation is to be given to the patient. And one more area, transferred whether in ambulance, arranged by hospital, accompanying the patient, name of that very person, with all this oxygen cylinder, emergency drug, IV line, etc. we have to mention. And monitoring during transit also, about pulse, blood pressure, saturation, respiration, rate, and details of events if at all it happens on the way. It shows your concern that you are taking utmost care of patient. So this is a checklist which kind of document we have to give to the patient, and preserve all this document. Whichever document you give to the patient, one copy should be with you. But you have not to remember this. You have to simply visit Foxy website, and on Foxy website under this title Foxy Uniform Consent, we three medical legal experts, Dr. Dilip Walke from Pune, Dr. Nikhil Datar from Mumbai, and myself, Dr. MC Patel from Ahmedabad, we have prepared 30 different consent, and it is available on Foxy website. Say for example, cesarean section, hysterectomy, abdominal, vaginal endoscopy, termination of pregnancy, medical method, surgical method, os tightening, consent for anesthesia, consent for blood transfusion. We have prepared consent at the time of transferring the patient. We have prepared consent for normal vaginal birth also. So you can download and you can use in day-to-day practice. It is available in English, in Marathi, in Kannada, and now Hindi and Gujarati version is on, and in near future it will be available. If at all anybody is interested to have soft copy, you can contact me. I will send you soft copy of all these 30 different consent which is available on Foxy website. And these uniform consent are taken into consideration in court also, because it was published on Foxy website and it was endorsed by Foxy. And when we prepared those consent, we had a collaboration with Maharashtra Law Society, and we involved 2 retired High Court judges, 1 sitting High Court judge at that time, 1 member from National Commission, and many a time for 1 word or 1 line, we had a discussion for hours together, and then we have come up with this consent. So it is endorsed by Foxy and Law Society of Maharashtra State. So in short, think positive, do positive, and be positive. If at all you are facing any litigation or so, you can have a phone call to your senior professional colleague and have medical opinion. you can have a phone call to advocate and have a legal opinion, or you can have a phone call to medical legal expert and you can have medical legal advice and relax. Do not get confused. Whether boy is hugging the girl or girl is hugging the boy, never get confused, but manage the situation promptly, precisely, efficiently, effectively, and meticulously. And it is observation on part of court only that in 40% litigation, doctor is behind doctor. This is observation from court only. So, do not criticize other doctors or paramedical persons if this is possible. If this is possible, and if cat and dog can share milk from the same dish, this picture, real picture taken by me only, then why can't we? And of course fight with each other, but be ready to fight for each other. And our approach should not be like this. अच्छा है कि नाव में छेद हमारी तरफ नहीं है. But we never know. We are sailing in the same boat. And do not quarrel in between so that third party could be at advantage. And as far as our practice is concerned, so in our medical practice scenario is like this. But it is more wonderful at the end. See. But can we do like this? Let us see. So, if we can do like this, then most of the problems are solved. And one more observation from court only, 40% litigation are due to rough behavior on part of doctor and hospital staff. So 40 plus 40, almost 80% litigations are preventable. So courtesy, consideration and communication is always beneficial. Our approach to the patient should be like this and should not be like this. And do not spoil your general impression because your deed is always watched by somebody. And never say I am insured. Because few of our friends have a habit, I am insured with insurance company, do whatever you like. Never say like this because you lose sympathy from patient and patient party very quickly. So never say like this, and it is very obvious. Those who are open, pleasant and communicative are much less to be sued by patient, are extremely forgiving of errors made by a friendly and concerned medical person. This is also one more area. Never detain patient for recovering the fees. There are other means to recovering the fees, civil suit or so, but you cannot detain patient for recovering the fees because you may invite litigation under section 340 Indian Penal Code, that is wrongful confinement, and there is a provision of 1 year imprisonment and or fine of rupees 1,000 or both. And this gentleman have so many staircases, but he doesn't know how to use them. So it doesn't matter how many resources you have, if you do not know how to use them, they will never be enough. There are so many provisions in law in our favor as far as our medical practice is concerned. And there are so many judgments in Supreme Court, in different high courts in our favor. But if we do not know, they won't be useful in our favor. So have some basic legal knowledge and always obtain medical legal advice whenever you are in doubt. So there is always a way. So to conclude with carry home messages, antenatal and labor ward protocols. Because in court or in law, they expect how you have managed your patient. If you have managed as per standard protocols, standard guidelines, then it is always in your favor. Adequate supervision and monitoring. Antenatal, during labor, after labor, before surgery, during surgery, after surgery. So adequate supervision and monitoring is very much must. Communication and proper counseling and proper consent, documentation and proper record keeping, foreseeability and anticipation, multi-speciality approach. Whenever you are in a little doubt, please call your professional colleague. Prompt diagnosis with necessary investigation, proper post-operative care by surgeon, particularly when he has operated at another nursing home. qualified anesthesiologist, audit of your own case, not to end up into same mistake in future, and formation of local level RUST team is also very much important. When I was Vice President Foxy, I had taken this task, and at that time more than 100 societies had formed RUST team in their society. So it is very much required at the time of surgical assistance, or at the time of declaring bad news, at the time of mob violence, or facing litigation. You have to phone call one or two person only. They will contact other person, and whosoever is available will be at your rescue. I would like to mention very good example which happened just 6 months back in city of Ahmedabad only. In Ahmedabad, we have RUST team in all the area wise. And in one of the area, it was case of cesarean section. After due course, patient was discharged. On 7th or 8th day, patient had been to hospital for follow-up and for dressing. And during dressing on table for any reason, patient suddenly collapsed. He tried to resuscitate, but ultimately patient expired. And relatives were very hostile. He had a phone call to only 1 or 2 gynecologists, and you won't believe within 1 hour, 150 gynecologists were there at that very hospital. And I was also there. We informed police. We insisted for post-mortem examination. Relatives were not ready to go for post-mortem examination. But once we had informed police, onus was on police to go for post-mortem examination. So relatives were very reluctant. They were not ready to go for post-mortem examination. Police informed magistrate in middle of the night. And magistrate came. Magistrate took statements from all the relatives. And in that very statement, specifically magistrate asked certain questions. You are not ready to go for post-mortem examination. You are not interested to know exact cause of death. You have any complaint against hospital, any complaint against any doctor? They said no. And that chapter was closed and doctor was saved. So what is the importance of RUST team? This is good example as far as our incidents at Ahmedabad. And same incidents happened in Nanded in state of Maharashtra. And all gynecologists gathered at that very hospital, and ransacking of hospital was prevented. So it is very important in era of this medical practice, we to be united. No compromise on statutory requirement. Say for example, if you are practicing sonography, naturally we have to comply with PCP and DT Act. If you are practicing abortion services with MTP Act, ART, then ART Act and Surrogacy Act. So we have to comply with all this statutory requirement and comply with the provisions of law. Professional indemnity, it is very much must. In era of this CPA, one cannot afford to practice without proper indemnity cover. So be vigilant in your practice. Take medical legal advice from point 1. Why we mention from point 1? Because once you submit any of your record treatment given to patient to anybody, then you cannot change. So if at all you have to submit any record, have a phone call to any medical legal expert and discuss your case. He will guide, because on Foxy website also all the numbers of medical legal experts who are giving these services are available. Even my number is also there and I am also available. So have a phone call before submitting any record to anybody. Identify yourself well in the court, otherwise be ready to face this type of situation in court. And usually we cross zebra crossing, but they may come, zebra may cross human crossing. So nothing to worry. What we do when there is a fire? Naturally we call firefighter. So manage the situation accordingly. So if ever you need me, I will be just round the corner. And Swami Vivekananda ji has very nicely written that real genius is one who can hold two opposing ideas in the mind at the same time and still maintain ability to work in a smooth, efficient and fast manner. I think it was written for obstetrician only. Because what he has written, two opposing ideas in the mind at the same time. In our obstetric emergency, we have the same situation, whether to do this or whether to do that. So, two opposing ideas in the mind at the same time. And still he expects to maintain ability to work in a smooth, efficient and fast manner. Only obstetrician can do. And one more sentence written by Albert Einstein, only two things are infinite: the universe and human stupidity, and I am not sure about the former. So, all the best. Wish you and me too all the best, because in spite of all this, our professional and occupational hazard, our journey to serve human and mankind is always on and on. So, if you want to sleep like this, take tender care of your patient, comply with the provisions of law, pray your Almighty God before going to sleep, and keep my visiting card below your pillow. And this is leopard behind innocent gynecologist, and see the role of medical legal counselor, how he can be useful. So do not hesitate to have a phone call to any medical legal expert in this type of given situation. So God bless you. Have a litigation-free medical practice. With regards, salute to organizers, and my commitments remains wherever you are, I will be there. Promise to reach the unreached. So please endorse my candidature for post of President Foxy. Please vote and make others also to vote in my favor. Thank you very much. Please do not assume. Please ask, if at all, any question, any query, if time and chairpersons permit. Thank you very much.